Hi, my beauties. I wanted to respond to someone's comment because somebody asked a really great question on my latest YouTube video on Easy Gel. So for those of you who don't know, Easy Gel is a safe alternative to dermal filler, and we use it a lot like in the tear trough area because it has a lot less risk and complications than dermal filler because it doesn't migrate. You don't have to worry as much about arterial occlusion. It doesn't have the Tyndall effect. It's a very natural looking result, and nothing is added to the blood products. It's from your own blood. It is growth factors, albumin, proteins, and a lot of growth factors that induce collagen synthesis and can rejuvenate the under eye area. So it's a great alternative, and we're getting amazing results with it. Patients are very happy. But somebody said that other doctors are saying that there is a slight risk or some risk of arterial occlusion with Easy Gel. And in my video set, I said that there was not. So I have to be careful also. Never say never. There's nothing 100% in medicine and in science. And I think that I want to correct my statement by always a risk of arterial occlusion, but with hyaluronic acid filler, the risk is a lot greater. When you use a cannula with either treatment, that risk goes down because it's a blunt-ended, it's not a sharp needle, it's a blunt-ended device instead of a needle distributing the product. And I can get way up into the lash line. I can get into areas with a cannula safely and effectively without really that risk or with a diminished risk. But you can still get arterial occlusion, I guess, in theory with Easy Gel. Not because it's made of blood products. Those blood products are made to be intravascular into the vessel. So if you inject them, it shouldn't in theory be as bad, but it's like a clot, right? So it's like if you have blood circulating in the circulatory system and you have a clot formation, you can have a thrombosis, which can cause, complications in the human body. So in theory, Easy Gel dramatically decreases the risk of arterial occlusion, but it is still a risk. So I wanted to correct myself. And thank you so much for pointing that out and bringing up this question. And it's more from like the clotting factors, or like having a blood clot circulating in the vessels could cause an arterial occlusion. Although I've never seen it in my career. It's never been presented in academic meetings, knock on wood. And I've never heard of it. But again, I want to be careful and never say never, but the risk is dramatically decreased. Hope this helps.